Dispatch.
Oh, come on, girl.
You're fine.
All right, go team.
Go team.
Yeah.
Oh yeah. What? Oh, is that?
It says assault at a bar.
Yeah, so medic one, please respond priority one for 34-year-old male, MVC, unknown at this time, number of patients or injuries.
Okay. BSI scene safe.
Yes, seen safe.
Number of patients.
Just one.
Mechanism, MOI.
Possible trauma from the accident.
Okay. So what am I doing? I'm coming up. Hey bud, how you doing? Hey, do you know where you are? You know what year it is? I'm checking C-spine, no drop off. Okay. What's my general impression?
Patient is awake but a little out of it.
So ANO 3.
803.
ANO 3.
Okay.
Okay. Do you have any pain anywhere?
He has pain in his lower back and also both of his legs.
Both of his legs. Okay. You feel any pain while I'm gonna check you? You feeling any pain?
No.
Okay. And when y'all doing the palpation,
Yes.
don't just love tap it.
Oh, you
Especially when you're doing pelvis,
look around.
firmly, do it. Now, if they do have the back pain, that's gonna be a little different. You're not gonna want to sit there and rock them, but you do want to check stability.
Okay.
So coming down to arms, can you squeeze my hands? Squeezing. All right, bud. I'm checking your legs. You feel any pain right now?
Yes.
Where's it hurting?
Upper thigh.
Upper thigh. 1 to 10. 10 being the worst pain ever.
11.
11.
Oh.
Tell me what kind of pain is it?
Very, very, very sharp pain.
Really sharp pain? Okay. Any protrusions
Yes. On the backside.
on that side? So I got extremity on bone. So let's say I got a bone sticking out right here. I'm still coming down. I got a pedal pulse.
Yep.
No pedal pulse. Can you feel me messing with your feet?
Barely.
Barely. Let me check your other side. Anything on this side?
No, just doesn't really. I can't really feel it that well. So
Okay. I got pedal pulse.
yes.
Pedal pulse. Can you push on my hand?
Barely. Toes are wiggling.
Toes are wiggling. It's okay. Now we're back to here.
Okay.
So we got a bone. Okay, so it is protruding skin. How would we splint that? Do we want to wrap it? Okay, so we would wrap that, right?
Yes.
But here's the other question.
How do we-
Traction splint. Would you want to use a traction splint with an external injury? Okay. Okay, and why is that? Okay, think about what traction is doing. It's pulling.
Is it gonna cause more skin?
There you go. Because you're going to end up it's going to try to suck back in, and you don't want to do that.
Yeah, y'all aren't surgeons, so don't try to
Yeah.
do surgery.
So we're just trying to immobilize it.
There you go.
That's the goal.
So longboards, wrap it.
Okay, and that's it. And we just.
There you go. But remember, he also had C-spine precautions. So C-spine's on,
Okay.
but I need to check his back because he said he had that.
Oh.
1, 2, 3. Checking his back. Do I feel anything?
Step off on the lower side.
So step off. I feel the drop, right?
Okay.
But now sometimes they'll say rolling back down. But guess what? If I have my backboard, I'm putting backboard all in one shot. Why am I going to create more injury? Backboard's on, coming down,
Boom.
secure 3 straps. Put them on the cot. I'm gonna transport to the most appropriate in the truck. Now I'm back in the truck, right?
Yes.
Getting my baseline vitals, doing another assessment. What's my vitals?
BP is 90/60. O2 is at 92%. Respirations are at 22, and blood sugar is at 90.
Okay, so blood sugar, should I worry about that?
No.
Okay, you said 90 on Romero. What should I do?
2 liter.
Okay,
Longer breathing.
90, I would probably go 2 to 3 liters nasal cannula. That's not gonna hurt nothing. Now if I need it, so I do that, oxygen's that improve?
Yes.
Okay, see, so now we don't have to worry about that.
Good.
Now after 5 minutes, if he's still not improving, go ahead and put him on 5, 6, at least, I would say 10 probably, non-rebreather, see if it improves. Now, if you have a long transport and you want to mess with it, all right, let me bump him down a little bit. See how he reacts. Now, if he starts declining again, right back to 10.
So if it was below 90, you would have gone with the non-repeater.
If he
mask
didn't,
as opposed to-
so I went on immediate 3 liters nasal cannula, but if he's not reacting to it and going better, I'll put the non-rebreather on.
Okay.
Especially his respirator is so high, he's trauma, he's freaking out kind of deal. So just kind of BSing with him, like, hey, it's like, hey, slow your breathing down, bud. In through your nose, out through your mouth. The more you can kind of BS with them, get them to your level, the more helpful it's going to be all around.
So we're just trying to get him to calm down and like
Correct.
regulate.
Yeah, like really just breathe in and
Yeah.
breathe out. 'cause
His blood pressure is low. As a basic, can you really do anything for that?
What was the blood pressure?
90 over 60.
Yeah. Yeah.
It's not horrible, but it is a little low. But he just has severe trauma. He has a leg fracture, or protruding bone. But in my opinion, should that have been a lot higher? It should have been.
Mm-hmm. Yeah.
So now I'm gonna check. Hey, are you on any blood thinners, any kind of blood pressure meds, different things? Asking the general questions to get that sample history.
Also, if you call additional resources and the paramedics are already there, you can have them like drop a line and bring that blood pressure up. Because y'all can't do that, but you can have them do it.
But if ALS was already there, they would.
Yeah, let's say, hey, ALS on scene.
Mm-hmm.
So ALS comes on, me and him in that, I'm gonna pop him with an 18 gauge, right AC carefully. I'm gonna do probably a bag of normal saline. I'm gonna run it wide open, try to bump that pressure up.
And then transfer hospital.
Mhm.
Yeah. And it's gonna ask you on that paper if you want to load or go. Always,
Oh, yeah.
Always go.
Always.
Like, don't stay in play. So.
Medical and trauma, do the load and go. Do your assessment in the truck.
Okay.
Because it could start out as a medical call and then all of a sudden it turns to a trauma call just like real quick. So that's why it's always smart just to.
You don't wanna risk it. And
Yeah, you don't want to stay playing there, and then you got to remember your time too. So like the longer you're on scene.
Medical and trauma, you have a 10-minute test
Oh
window.
yes.
Yeah.
So before the 10 minutes, you gotta say,
All of that.
call for transport.
So in that 10 minutes is BSI scene safe, all the way to general impression, primary assessment, OPQRST, your sample, your secondary, vitals, transport decision.
In the first 2 minutes, they had already gone through the entire like first chunk. So
So
like,
there's like a if y'all have pencils on you right now. There's like a good acronym that you can write down. So first one is S for scene size up. Second one is mechanism of injury, slash N, number of patients. Then you're gonna go A for additional resources. And then as I'm saying this, go ahead and look at the
Oh, we
checklist.
have-
Actually, that's
Oh, yeah.
what Tatlo gave us.
Okay, so
Snack.
that's the one he was talking
Snack,
about.
snack.
Honestly, yeah, if you just memorize that, and then I
Snack
think it's
for nature illness.
Yep,
Yeah.
that one.
Medical and
Yeah.
snack.
And more
But see, and I apologize, if y'all noticed, remember I said I have my own way of doing it now? I jumped around on that thing bigger than shit. But even with y'all following it, did I hit every single thing
Yeah.
almost?
yes.
And is that what y'all are looking for?
Making sure we're hitting y'all are hitting every single point.
When it comes to the skin, do we need to say that as we're assessing the skin?
Yeah, so when I'm saying, hey, what's my general impression, what's the skin?
He was palpating and he was like, but yeah.
Because, just because of the way they say it, and then I don't want to.
Yeah. And me
I was just saying 'cause
verbalizing,
you didn't
I-
say the skin.
I'm having to relearn how to verbalize it with y'all to demonstrate it. Because you can ask him, he's been on scenes with me, I don't verbalize at all.
Mhm.
I'm just sitting there doing what I have, BSing with my patient. I'm doing what I have to do. When my medic walks up, he's like, hey, this is what I got, da 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 da. And we just kind of meet in the middle.
But for our context, we need to
Exactly. And that's the reason I'm trying to do
Yes.
a better at verbalizing for y'all to demonstrate that.
I see now.
And we would be verbalizing just like you did right now.
Correct.
Which is always something to get used to, because like you're not gonna be on scene and be like, BSI, scene is safe. So like people aren't looking like, what's wrong with this guy? So like, you just
What
gotta
kind
get
of
used
jazz
to it.
hands, sir?
Yeah. But rule of thumb, is the scene ever 100% safe?
No.
The worst scenes that are not safe, I would rather be in a crack house than on the side